A 24-year-old Primigravida client has just given birth to a Rh-positive child and she herself is Rh-negative. The nurse recognizes this situation can lead to future problems in terms of future pregnancies due to this blood type mismatch. All of the following are associated with Rh factor incompatibility except dash. A. May lead to fetal anemia and lead to an acceleration of red blood cell production if the mother is not given Rho. D immune globulin to prevent antibodies from destroying fetal blood cells. B. The mother will form IgG and IgM antibodies in response to being exposed to a fetus incompatible blood type. C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. D. The mixing of fetal blood with maternal blood may occur during an amniocentesis or early separation of placenta during birth. E. Kernicterus is a potentially serious effect due to pathological jaundice that can have long-lasting neurological effects on the child if not prevented. The answer is C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. Blood clots are not a common effect in the fetus due to Rh incompatibility. A disorder known as erythroblastosis fetalis is a type of hemolytic disease that occurs in the fetus due to an immune reaction of the Rh-negative mother in an Rh-positive fetus. All other choices are associated with this type of incompatibility. Which type of abortion is associated with sepsis, cramping, abdominal tenderness and an open cervical loss? A. Threatened abortion. B. Spontaneous abortion. C. Inevitable abortion. D. Complete abortion. E. Missed abortion. The answer is E. Missed abortion. A missed abortion is marked by the death of the fetus in utero but is not expelled from the uterus. If left untreated can lead to infection in the womb. It is marked by foul odor and bleeding as well as an elevated temperature and sepsis. Which of the following statements is true about a high-data-deformed molar pregnancy? A. A molar pregnancy is a type of ectopic pregnancy in need of dilation and curettage to prevent internal hemorrhaging or possible hysterectomy. B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. C. The cause of a molar pregnancy is due multiple ovum becoming fertilized and coalescing to form a cluster of atypical cells containing a haploid number of chromosomes. D. A molar pregnancy can proceed without incident once Rho immune globulin is administered to the E. A high-data-deformed molar pregnancy is reported to cause malignancy in approximately 60% of cases. The answer is B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. A high-data-deformed molar pregnancy is mostly a benign process that may occur due to an abnormal ovum becoming fertilized and growing into collection of cells in a cluster-like formation. They are benign over 80% of the time. Rho immune globulin is a medication administered to an Rh-negative mother that will give birth to a second Rh-positive child to prevent an immune reaction that may harm the child. A woman is hospitalized for preeclampsia. Which medication may the nurse administer to prevent the occurrence of seizures? A. Calcium gluconate. B. Zolpidem. C. Pitocin. D. Nubane. E. Magnesium sulfate. The answer is E. Magnesium sulfate. Magnesium sulfate is used to prevent seizures in women with severe preeclampsia. Calcium gluconate is the antidote if magnesium toxicity is assessed. It should be readily available when a woman is receiving magnesium sulfate. Pitocin is used to stimulate the uterus, often to induce labor. Nubain is an opiate that can be given to women during labor to treat pain. Zolpidem, Ambien, is a sleep aid. Jean is a 33-year-old woman who has previously had regular periods but has not gotten her period for 6 months. Which of the following would the nurse rule out as the cause? A. Cross-country running 5 times per week. B. Poor eating habits. C. Yoga once per week. D. Kidney disease. E. Antidepressant use. The answer is C. Yoga once per week. Yoga once per week, light exercise, is the least likely of the above to cause a change in regular menstruation. Cross-country or long-distance running, vigorous exercise, is more likely to cause changes to a woman's cycle. Poor lifestyle choices such as eating habits and health issues such as kidney disease can also cause irregular menstruation. Likewise, pharmaceuticals can have the same effect.